I'm Stephen LeBlanc from the University of Guelph. I'm going to share a brief summary of a randomized controlled trial that we recently conducted with SoyChlor to assess its effects on health, production, and reproduction in dairy cows. This was the doctoral research program of Rita Couto-Sereno. We know that hypocalcemia and milk fever are big problems in the dairy industry, and although there are a variety of tools to help prevent these problems and their consequences, there isn't that much known in large-scale commercial field studies on the effects of a negative DCAD diet. So we set up a large controlled trial on 4 dairy farms in Ontario. Each farm had a close-up dry cow group that was either fed the SoyChlor or a placebo in the diet, so that the diets were equal and the farmers and researchers didn't know which cows were getting what. We achieved an acidification as planned with a target urine pH of between 6 and 6.5 in the treatment group. Each pen was fed the treatment for approximately 3 months and then switched to the control and back again, such that over the course of a little more than 1 year, these 4 farms contributed well over 1,000 cows to our research program. Our technicians and researchers visited each farm each week to collect data on health and got reproductive and production data from DHI records and the on-farm computerized records. Our first goal was to improve the cow's metabolism of calcium, and in that way help to prevent subclinical hypocalcemia after calving. And in fact, we achieved that. In particular in multiparous cows, meaning cows in their 2nd, 3rd, or greater lactation. We did see smaller effects as expected in the same direction in animals in their 1st lactation. But here you can see that over the first 4 days after calving, the cows that received the SoyChlor had significantly higher blood calcium concentrations than the cows in the control group. One of the most important things in this study was to have sufficient numbers of cows to look at health outcomes. And we did in fact see some benefits, particularly in terms of preventing milk fever. As you can see, on average, the milk fever incidence in the control group was over 7%, but less than 2% in the SoyChlor treated group. And in fact, that was particularly driven by over-conditioned cows that had the most pronounced benefit of being on the negative DCAD diet. We did not see differences in retained placenta, metritis, or ketosis, but we did have a significant reduction in the incidence of displaced abomasum and a tendency to have less clinical mastitis in early lactation in the cows that received the negative DCAD diet in the close-up dry period. There were no differences in the prevalence of purulent vaginal discharge at 5 weeks postpartum, or in the number of cows having a single disease event. But in the multiparous cows, we did see a reduction in the proportion of cows experiencing 2 or more disease events in early lactation. In terms of milk production, there was a significant benefit of the SoyChlor treatment in the close-up dry period for the multiparous cows. So in cows that were in their 2nd, 3rd, and 4th lactation or greater, those cows accounting for fat percentage and protein percentage produced more milk at the first test postpartum, significantly more in the order of well over 1 kilogram of milk per day at the start of lactation. In primiparous cows, animals in their 1st lactation, we did not detect a significant difference in milk production. Finally, in terms of reproduction, again, in the multiparous cows, we saw a benefit such that the pregnancy rate in those older cows that had received the negative DCAD diet was improved, reducing their median time to pregnancy by about 11 days. But in the primiparous cows, unexpectedly, their pregnancy rate was worse in the in the treatment group, such that their time to pregnancy was actually increased by about 21 days. So to summarize, we did a very large controlled trial on 4 commercial dairies over the course of over 1 year. We achieved the acidification that we set out to, and in so doing, we're able to improve and increase blood calcium levels in the multiparous cows and decrease the proportion of cows that had subclinical hypocalcemia. We reduced the incidence of milk fever in multiparous cows and reduced the incidence of displaced abomasum and clinical mastitis across the board. There were no effects on ketosis, retained placenta, metritis, or purulent vaginal discharge. In the multiparous cows, we had an increase in energy-corrected milk at first DHI test, also an increase in pregnancy at first cervix, which led to an increase in their pregnancy rate throughout the whole lactation. Whereas for the primiparous cows, there was actually a decrease in their pregnancy rate. So our take-home message is that there are clear benefits of a negative DCAD diet for multiparous cows. Mostly no effect in the primiparous cows, but an unexpected reduction in their pregnancy rate. So if possible, it would be ideal to target these nutritional preventive approaches to multiparous cows. Thanks for your attention, and we'll have another version of this that goes into more detail later.